Thank you. Thank you, Dr. Coulter. Thank you, Dr. Rogers. I'm grateful for you guys to spend some time with me today. The session is called Cardiometabolic Syndrome in Children, a Sign of Things to Come. I'm Sunny Harpavat. I practice at Baylor College of Medicine, Texas Children's. I am not a cardiologist, so it's a real honor to be amongst cardiologists. The cardio is in parentheses, metabolic is what we do. I'm a liver doctor for kids. So I like to think in terms of analogies. In this talk, an analogy we'll run through. It's a swimming analogy. And I'd like to sort of emphasize the point that was already emphasized by every single speaker before us, that people are drowning. 25.24% of the population have liver disease related to what we eat. 2 billion people. And 20 million liver deaths will result from this. These numbers are astronomical. Now, take a quick diversion really quickly. Up in the right corner, you can see I actually study a congenital liver disease. It's rare. It's a different story. This is my academic life. I might be sort of leaving my lane a little bit here because I'm going to go down the bottom corner, which is I'm going to talk about what I do on the advocacy front, not on the academic front. And that's because we live in this great city, Houston, one of the most diverse cities in the world, and some work with Texas Liver Foundation. So before we start, if I ask the audience, what does the heart do? Hopefully, I'm in the right place. You guys would all know. If I ask the audience, what does the brain do? Same. Kidney, same. If I ask you, what does the liver do? That's where you scratch your head, some blank stares. It's this organ. In fact, it was noticeably absent in many of the talks before. So let's keep it simple. One thing the liver does, all the food we eat, without exception, what you had for breakfast, what you're about to have for lunch, the first place it goes to is the liver. The first place. The liver cleans it, processes it, and then sends it to the rest of the body. So it's pretty clear that if we are going to have any cardiometabolic talk or any real discussion, the liver is the gateway. It's going to be the first organ to think about. So going back, people are drowning. So what can we do? We can throw some lifesavers. One lifesaver, someone already talked about, Dr. Galati, liver transplant. We do a lot of those at Texas Children's, even more at Methodist and St. Luke's. In the US, 10,000 liver transplants a year. So you do the math. There is no possible way we have enough lifesavers to deal with the problem at hand. No way. Now we have medicines, expensive medicines. We've talked about those. And we can change people's habits. Dr. Galati started with that. I think a lot of the talks are jumping around the same theme. And let's be honest, let's not talk about our patients, let's talk about ourselves. How hard is it for us to change our habits? It's not exactly easy. So when we tell our patients to do the same, that's difficult. So now let's go to the theme of the talk. I'm here to tell you that changing habits is actually possible. It is effective and it is easy. But where is it easy? It's easy for children. So teach children to swim. There's two good reasons. Number one, this discussion is fundamentally a pediatric problem. People don't wake up one day, no diabetes, the next day diabetes. Adults don't wake up one day, no hypertension, the next day hypertension. We all know that this is a gradual process that accumulates. Here is a growth curve, and this is not atypical. Now, for those of you that aren't used to looking at pediatric growth curves, the x-axis is age, the y-axis in this case is weight, and these lines are percentiles, basically different percentiles of where you fall. And you can see this child at age 11 in our clinic, his dot is above the 97th percentile. That's shocking, startling enough. But what is incredible, if we open our eyes, is look where this started. It didn't start at even age 11. This started at age 4 and earlier. So already we talked about accumulation of disease. This child at age 11 has already had 4, 5, 6 years of accumulation of disease. And I'm not showing exceptional cases. This is what we see over and over again. And number two, children are still forming habits. So if we're going to ask people to change habits or form habits, you guys, we have that. We have an easy, sort of a no-brainer, low-hanging fruit. This is where to do it. This is a randomized controls trial of a low-sugar diet versus a normal diet. And what they did is their endpoints, doing 8 weeks of this diet, the endpoints for these authors was either fat on MRI or ALT, which is a marker of liver injury. And what you can see, the patients with the low-sugar diet, the dashed line is the baseline, the dots are where they ended up. And you can see on the low-sugar diet, not only did every child, or almost every child, have a decrease in fat in their liver, but children also had a decrease in ALT. Now, that's a habit. And to ask children to go and institute a low-sugar diet, this was less than 3% of calories from sugar. So that's very, very difficult. Not only difficult, it's vague. It's hard to explain. It's hard to implement. And so we've taken this on an advocacy level and we've simplified. Simplified in 2 steps. In number 1, when they come into our office, we say, cut all sugary drinks. So this is the poster that we have on the back of our doctor's offices and we dream about having in the back of all doctor's offices. So while your pediatric patients are waiting for the doctor to come in, I don't know about you guys, we're oftentimes late, this is what they get to look at. This is a drink demonstrating the amount of sugar. There's very few children and parents I know that can relate to 67 grams of sugar in a glass of lemonade. Almost every single patient and parent can relate to 248 chocolate chips worth of sugar in a glass of lemonade. Some people get disgusted by this. The critics sort of argue and get too technical with it. Some people say, I'm going to change. The point is, it stimulates a discussion, and that is the first step towards forming that habit. Number 2, kids, I think we all know, we're all kids at one time, and we oftentimes know a lot of kids. There's this really sense of curiosity and logic that kids like. So you ask them to break apart a word that they say every day, breakfast. They split it into its parts, and then they start thinking, and you can see their mind thinking, what does this mean? And they realize, oh, it means break a fast. And this is our opportunity to say, after dinner, zip the mouth, nothing else to eat until the morning. Go through that fast. This is the introduction in a soft, gentle, doable way to the intermittent fasting that I think many of us have tried, probably failed, and that is kind of impossible. And then we're stuck with number 3. And if these things don't work, if these 2 habits don't form, then we have to treat. And Dr. Galati brought this up. I think maybe liver doctors think alike. We pulled the image of the conference, and the word health crisis was there. Sometimes crisis might be an exaggeration. I don't think it's an exaggeration in this case at all. A crisis requires drastic solutions. And for those clinicians in the audience, I'm curious what you would do. An 11-year-old, an ALT of 58, hemoglobin A1C of 5.9, fasting insulin of 81. What do you do? And in fact, what we are thinking about doing in these small kids is starting treatment if these 2 habits don't form. Again, drastic times require drastic solutions. So, people are drowning. Teach children to swim. Now, the third part is it's really, really hard to teach a child or anyone to swim if you're going to throw them into the ocean, right? Better to do it in a pool. And what do we mean by ocean? Well, I think we can all relate to this. A dark, deep, dangerous ocean is not the place where you're going to teach someone to learn a new trick. So here's the ocean we live in. And this is a radius of around 3 miles from each other. And you can see, I've only highlighted through Google Maps to McDonald's. Those are the red dots, if you can't see it. Only the McDonald's. So you can imagine if we tried everything else, you might not see anything except dots. So this is the ocean our kids, once we formulate these 2 habits, no sugary drinks, no eating after dinner, this is the ocean that they're going to learn to use these tricks in. So Even though this is bad, this is a talk of hope and possibilities. So I'm going to share just a small story with you. And that is, for those of you at THI, those of you local, you probably recognize this one, which if you had a microscope and you looked in, you would see us sitting in a conference room, because that's us right up the stairs. I know it's closed. And so someone made the comment was, it's closed now, for reasons that we can talk about. So this is the question that came up. What's a McDonald's doing in your hospital, our hospital? And I think it's a really fair question. Now, this is where we can debate, and this is the fun part about a talk like this, and is the fun part about being in pediatrics. There's always a discussion. There's always new ideas. And the experiment came up. This was actually, even though it's on St. Luke's property, this was a Texas Children's McDonald's. And the experiment came up, do we ask McDonald's to leave? Makes sense. That's a win. They're out. Or do we do the experiment? Do we leave them in place, ask them to change, with the dream that they might change some more McDonald's in the ocean, or they might change all the McDonald's in the ocean? Okay. This was sometime back when I first came here as a resident in 2006, and there was a visionary pediatrician, Ralph Feigen, and he convinced me, because I brought up the question, he convinced me, let's try the second. And I said, are you sure, Dr. Feigen? He said, let's try it. So what he did is he called all the guys from Chicago, some exec team flew down, and we had a talk, and we said, this is what we want. We want the menu to be labeled. We want apples in the Happy Meals. We want the Happy Meal drink focused on kids to not be soda. Well, this is the story, and this is how it plays out. This is the ACA. Those were great times. Look who's there. You can probably see the winners of the presidential election. ACA came next. Menu labeling became standard on all menus. So our label menu thing, that was good, it was going to be done anyways. The real magic for the experiment was the apples versus fries, because almost immediately the Happy Meal fries ended at Texas Children's. Great, victory won. We had meetings 4 times a year with the Chicago team, seeing how this was going, ways we could improve it, problems that arose. And then off cycle, I got a call from Chicago. They said, we're flying down and we'd like to talk to you. And why do they want to talk to me? Because they wanted to tell me beforehand that they intended, but they would need a little time, to put apples in every Happy Meal in the country. Apples across the ocean. Okay? Do you know why it took they said, we'll do it, we intend, but it'll be a little time? Can anyone guess? Because there weren't enough apple growers to provide that many apples for Happy Meals. Okay? So now, today, whether you're from Baltimore, San Francisco, Dallas, Miami, Omaha, any city in this country, if you go, apples are standard in all Happy Meals. Every child will be exposed at least. I'm not saying they're going to eat it, but at least that conversation can start with their parents, and they'll be exposed to a fruit. Okay? So this is an example of the ocean being able to change, though I've got to say, maybe in sort of creative and maybe unexpected ways. I'm going to leave 2 more examples, and I think we'll be able to catch up on time, Dr. Coulter. This was what we were trying to do, and McDonald's left, so this effort has stopped. But this was to change the Happy Meal drink, and we were anticipating some problems. This was a little placard every family got that got a Happy Meal, talking about the change. And if you were upset that your child didn't get that glass of soda, you could see my email was there, my phone number was there, and this was true. I very much looked forward to hearing your point of view and discussing the issue further. So McDonald's could help. Just the last example, changing the ocean. For those of you driving on Highway 59 last summer, Houston billboards, not really a high point of our city, but this is the sort of the requisite public injury attorney billboards on the right. But on the left, you might have noticed this. I don't know if anyone saw this. These are our little shots, sort of attempts to change the ocean. Ask your doctor, what's my ALT? And Dr. Ballantyne, I don't know if you're here, but if you know Jose Altuve, we've been trying to get a hold of him for 3 years now. If he asked the question, what's my ALT, Altuve, this would literally change the world, okay? So this is a billboard, another shot at it. Hopefully this will stimulate some discussions about next shots. So with a few minutes left, here's the summary. People are drowning, 20 million liver-related deaths based on what we eat. Number 2, to prevent this drowning, the solution actually isn't that hard to dream of. Maybe it's a little hard to implement, but teach children how to swim. Why? Because this is fundamentally a pediatric disease. This is where it starts. And children are still forming habits. It would be our dream, I think we'd all agree, if we put ourselves out of business and we never had this conference. And there's a chance we could do this. And then number 3, it's really hard to learn for a child or an adult to change habits if you throw them in a deep, dangerous, dark ocean. So with a little creativity, a lot of hard work, partnerships, and I know when we were thinking about this, HEB was planning on being here. I don't know if you are, but if you are, collaborations with community people, we can change the ocean. So we can change the ocean. Thank you.